across the country. Today, there was a rare bipartisan town hall meeting in Texas. Congressman Pete Sessions made it clear what he thinks of government involvement in health care.
Congressman Sessions.
Well, I will call it socialized medicine because that's exactly what it is. And
it's better than nothing.
I'm sorry?
It's better than nothing.
Well, you said I could call... You said people could call it what they choose to.
Joining me now, fresh from that town hall meeting, Republican Congressman Sessions. Your partner in that meeting, of course, was Congresswoman Eddie Bernice Johnson. And the fact is, Congressman, what would you call Medicare? Is that socialized medicine?
What I would call Medicare is where people pay into a system throughout their life. And it is a government-run program that is going bankrupt, that is a real problem, not only in paying physicians, but in getting the services that people really need. It works. The bottom line is that this Obama plan would take $500 billion out of that plan to fund this other system, and that's the problem. Seniors need to make sure that they have a secure system with the knowledge that members of Congress can make wise decisions about public policy to support the plan that they're on, and this would exacerbate that towards bankruptcy.
Congressman, what do you think of the plan for co-ops? Would that be an acceptable substitute for you, something that is now being worked on in the Senate Finance Committee?
Well, I think to say for me, I would say no. I would say for efficiency and effectiveness and to be a model that works, I would also say no. They're so small, and they would work in a small way within state lines when, in fact, we need larger pools of people to be able to be cost efficient. And this is where the President needs to understand that we should change the tax laws to give every individual the opportunity and advantages that people who work for corporations have. If you do that, you change the equation of who can buy these larger health care plans and insurance that work for everybody.
But what would you do for people who are not employed? All of those people who wouldn't be able to buy into something. Changing the tax law doesn't help people who are unemployed or who are not paying taxes.
Andrea, I do know that that's a good question, but it takes care of the vast number of the 47-some million people who today do not have insurance. A huge number of them are self-employed and would like the opportunity to have some sort of a health care plan. If you give them the tax advantages to where they are paying for their health care on a pre-tax basis, that dwindles down the number from the 47 million to where we're dealing with fewer people. One of the problems with the Obama plan is it takes the 200+ million people and puts them in the same boat as the other 12 to 15 million that you were in reference to that may not currently have a job or the ability to pay for insurance. It should be done in reverse. We should do every single thing we can to take people to be a part of a free market health care plan where these plans are larger, bigger, and deal with the two problems. The problem of wellness and how we get people to be well and to keep them healthy, and then chronic illnesses. Chronic illnesses are a problem, and a health care plan can do that by having your physician work with you for the individual to be healthy.
All right, Congressman Sessions, thank you so much for joining us from Dallas, Texas. And now we go to Phoenix, Arizona. The President is about to address the veterans of foreign war. We understand he will speak about health care as well, of course, speaking about the wars in Iraq and Afghanistan, where there are crucial elections this week. Let's listen to the President.
Also acknowledge Gene Gardner and